Hello students, so welcome back to my channel. You're watching Sandhya OBG Study Point. So today I just brought a new topic, that is antenatal care. Okay, so in that we will just go through an assessment, that is antenatal assessment, how we can assess a woman during pregnancy. Okay, so that is the procedure. So we will just go through that in this video. So how we just can conduct that procedure, so we'll just do it in today's video. Fine. So before directly jumping to that assessment, let's have a clear concept of an antenatal assessment, actually what it is. So let's have a look on a definition of an antenatal assessment. So here it is. The antenatal care involves assessing and guiding a pregnant woman as the pregnancy progresses through each trimester. Trimester, a period of 3 months during the pregnancy of a woman. Fine. Before starting an assessment, we should have a clear confirmation of pregnancy and how we can confirm that the woman is pregnant. So here are some of the clinical signs of pregnancy on the basis of which we can say like the woman is pregnant. Okay, so these signs are categorized into 3 categories, that is presumptive, probable and positive. Okay, so what all the clinical signs of pregnancy in a presumptive manner? So here are some of the presumptive clinical signs of pregnancy, that is amenorrhea, that is the absence of menses or periods we can see. Next is nausea, vomiting, especially in the morning. Okay, so if the woman is experiencing morning sickness, then also we can say like it's a sign of pregnancy. Next is frequency of micturition. Next, breast changes, quickening, fatigue, dark blue discoloration of vaginal mucosa, that is Chadwick's sign, pigmentation of skin and abdominal stereo. Okay, so these are all the presumptive clinical signs on the basis of which we can say like the woman is pregnant. Now moving to the probable clinical signs of pregnancy, that is an enlargement of abdomen. Next is changes in the size, shape and consistency of the uterus, that is Hager's sign. Next is a fetal outline on palpation and ballotment, softening of the cervix, Braxton Hicks contractions, positive pregnancy test of urine, external ballotment, internal ballotment. Next is immunological test. Now moving to the positive clinical signs of pregnancy, that is fetal heart sound present, fetal movements felt by the mother and examiner. Next is a fetal part palpable and ultrasonography visualization of the fetus. Okay, so these are all the clinical signs of pregnancy, so that we can say the woman is pregnant, we can confirm the pregnancy of a woman. Fine. Now moving to the history collection part of the pregnant mother, how we can collect a history, on the basis of what? So these are all the tips here. Okay, so first history should be collected on the basis of socio-economy. Okay, so socio-economic history, in that what all the things, what all the variables we can go through, that is name, age, address, education, occupation of husband, duration of marriage, religion and period of gestation, etc. Fine. Now moving to the next history collection on the basis of present pregnancy. So in that we can go through the history collection that is related to complication in each trimester. For example, if the mother is suffering with severe vomiting during pregnancy, then that is hyperemesis gravidarum. And also other than this, we have to collect the history on the basis of sleep, appetite, bowel and bladder habits, etc. Fine. So now moving to the next history collection, that is obstetrical history. So in that we will ask the questions regarding the number of living children, health status of the baby, pregnancy events and duration of pregnancy in all children, method of delivery, etc. Okay, so now moving to the next history collection on the basis of menstrual history. Okay, so now in a menstrual history, of course we have to just go through the menstrual questions regarding cycle, duration, amount of the blood flow, last menstrual period, expected date of delivery. Okay, so these are all the points should be collected in a menstrual history. So now moving to the next one, that is past history of illness. In that we will just include medical and surgical history. Okay, so in that we will just go through any kind of the medical illness like hypertension, diabetes, previous operations, history of blood transfusion. So history of blood transfusion is also necessary to be collected, so that we can prevent any kind of the complication may occur during delivery at the time of present pregnancy. Okay, so that these are all the things should be collected on the basis of past history of illness. Next is family history. So in the family history we will just ask the questions regarding cardiac disease in the family, drug abuse, alcohol abuse, etc. Okay, now moving to the personal history, personal habits, use of contraceptives, smoking, alcohol, drug allergy and food habits, etc. So now moving to an antenatal examination, in that we have to do the physical examination, the general physical examination on the basis of the appearance of a pregnant woman. Okay, so first of all we have to just assess how the build is, the body building is, whether it's obese, average or thin. Next is height. If the height is less than 145 centimeter, is considered short stature. Next is vital signs. Of course we have to just check the vital signs of a pregnant woman. In the vital signs we have to just assess the temperature, blood pressure, pulse rate and respiration rate, and after that we have to start doing the head to toe examination. In that we have to assess the scalp, whether it's clean, presence of infection and infestation. Okay, next is face. In the face we have to assess the facial expressions, whether it's lethargic, pale, confused, paler skin changes, mask of pregnancy. Sometimes it can happen during pregnancy. Next is swelling of the face, eyes, nose, lips, mouth, for dental caries and bleeding gums. Okay, now moving to the next, that is neck, whether the neck is symmetry, shape and lymphadenopathy, etc. Okay, so we have to go through this. So in the breast examination we have to check for symmetry, breast changes, secretion and conditions of the nipples. Okay, upper extremities, check for any bony deformity, capillary refill in nails for pallor. Next is legs, hormone signs, edema, varicosities and bony deformity. Next is back, and on back we have to check for normalcy of spine, symmetry, rhomboid or Meckel's. Next is bowel and bladder, whether the mother is suffering with constipation and incontinence, etc. Next is vagina. In the vagina we have to just assess the bleeding, discharge, infections, voids, etc. So now moving to an abdominal examination. In an abdominal examination we have to just keep some of the points in our mind, like first of all we have to just do the preparation of a woman for abdominal examination. So what were the things we should do in the conduction of abdominal examination? First of all we have to just ask the mother or woman to empty the bladder before examination, assist her for dorsal or supine position on the examination, couch with legs flexed. Okay, next is provide emotional support, and additionally I just forgot to mention here, also we have to just take care of her privacy. So these are all the points should be kept in our mind before just conducting this abdominal examination. So what were the steps here of abdominal examination? First is inspection. In the inspection we will just inspect the uterus, and in the uterus we will just check the shape and the size of the abdominal contour, fetal movements. Okay, and next is we will just see the skin changes on the uterus, I mean on the abdomen, whether the linea nigra is present, linea alba, and presence of any scar. Okay, next is check fundal height. Take fundal height in a centimeter and in weeks. Place the ulnar border of the hand at the highest point of the uterine fundus and compare it with accepted levels for the different period of gestation. Each 4-week period is equal to the width middle 3 fingers. Okay, I have shared a chart here. You can pause the video and just go through this chart. Now moving to the next examination, that is fetus in uterus. How we can assess the fetus inside the uterus? On the basis of fetal lie, attitude, denominator, position, presenting part, presentation. Okay, first of all let's have a clear concept of fetal lie. What is fetal lie? The term fetal lie refers to the relationship of the long axis of the fetus to the long axis of the maternal spine. Okay, now moving to the next one, that is attitude. The term attitude refers to the relationship of fetal parts to one another. Okay, next is denominator. It is an arbitrary fixed points on the presenting parts which comes in relations with the various quadrants of maternal pelvis. Position. Now it is the relationship of denominator to the different quadrants of maternal pelvis. Now what is presenting part? It refers to the part of presenting which lies over the internal os. Next is a presentation. The term presentation refers to the part of the fetus that occupies the lower pole of the uterus. Okay, so it was all about the inspection. Now moving to the palpation. So here how we can do the examination while palpating the abdomen. So here are some of the tips. So first of all, we have to do the fundal palpation to determine if it is a breech or the head, that is presentation. Okay, we have to just check for the presentation while palpating the fundus of the mother. Okay, next is lateral palpation to determine the position of the fetal back and limbs, that is to determine the position of the fetus in the uterus. Next is pelvic palpation to determine the presentation, flexion of head and ballotment of the head. Next is Paulic grip to see the size, flexion and mobility of head, breech, and to know the engagement of presenting parts. Okay, now moving to the auscultation. Fetal heart sound can be heard with a stethoscope from 18 to 20 weeks onwards. It states whether the fetus is alive or not. Normally the fetal heart rates ranges from 120 to 140 beats per minute with an average of 140 beats per minute. Okay, now moving to the next, that is vaginal examination. So in the vaginal examination, it is generally done by the doctor when needed, especially towards the end of the pregnancy, to ensure normalcy and adequacy of the pelvis to deliver the baby. Fine. So now next is laboratory investigations. It is necessary to take laboratory investigation for abdominal examination. Following are the lab investigations: hemoglobin, urine analysis, blood grouping and rhesus typing, VDRL and HIV testing, or we can say viral marker testing, pap smear and blood sugar. So now moving to the next step, that is calculating expected date of delivery. This is done according to Nagel's formula, that is expected date of delivery is equal to last menstrual period plus 9 months and 7 days. For example, if the last menstrual period or LMP date is 14th of November 2022, then the expected date of delivery will be 21st of August 2023. Okay, now moving to the next one, that is the indicators of the fetal well-being. Okay, how we can say that the fetal is completely normal and fully well-being, So here are some of the tips, like the uterine size compatible with the gestational age of the fetus. Then we can consider the pregnancy is okay. Next is normal and regular fetal movements. If at least 10 movements are felt by the mother within 12 hours, then the pregnancy is okay, fine. Next is fetal heart rate is a range of 120 to 160 per minute. Next is desired increase in maternal weight occurs. Normally there is 11 kg weight gain during pregnancy, out of which maximum weight gain occurs during the second and the third trimester. Okay, so that's it for today. I hope you enjoyed this session. If yes, then please hit like this one, and also you can get connected with me by subscribing to my channel for more interesting and important topics of OBG. And also you can suggest me some of the topics you want me to just teach you all on online mode. So just comment me down below in a comment section. I will just try my best to just create a video on that particular topic and share knowledge with you all. So keep studying, work hard and shine like a star. I will see you in the next one. Till then, goodbye and take care. Bye bye.